passing it over to our panelists to get things going. First up is Dr. Ulysses Dorotheo. Yul, take it away.
Thanks, Mikhail, and good day to everyone. As Mikhail mentioned, my name is Ulysses Dorotheo. I'm a Filipino physician living in Manila, and I represent the Southeast Asia Tobacco Control Alliance. Over the past 30 years, I've met many tobacco victims, majority of whom began cigarette smoking in their teens, attracted by Marlboro and other cigarette advertisements, and whose lives have been forever transformed by their addiction. Some of them have died prematurely from tobacco-caused diseases such as heart and lung disease and cancer, and others now live with lifelong disability. In recent years, Philip Morris has been talking about its company's transformation and of unsmoke, and is rolling out heated tobacco products in many countries, such as the Philippines, promoting them as significantly less harmful alternatives to cigarettes. After many decades of denial, Philip Morris has finally conceded that cigarettes are harmful and that people should stop smoking. However, it is misleading and hypocritical to claim corporate transformation if Philip Morris, now admitting cigarettes are harmful, continues to make these same harmful cigarettes, continues earning most of its profits from them, and continues opposing stringent tobacco control measures aimed at reducing cigarette use. While talking about transformation, Philip Morris continues to sell cigarettes to teenagers and poor people on the streets of Manila and throughout Asia. While claiming to promote a smoke-free future, Philip Morris sued a small town in the Philippines when the city council passed a smoke-free ordinance and a tobacco-free generation ordinance, both of which were aimed at protecting its young people from cigarettes. If its claimed transformation were genuine, Philip Morris would be voluntarily taking responsibility for selling these harmful products by implementing a global product recall for cigarettes, retracting its opposition to strict tobacco control measures, and compensating its customers who became sick or died prematurely or suffered daily with tobacco-caused disability. But we know Philip Morris is doing none of that. Even during this ongoing coronavirus pandemic, Philip Morris continues to make and sell cigarettes, completely disregarding warnings by health authorities, such as the World Health Organization and our own Philippine Department of Health, both of which have warned that smokers are more vulnerable to being infected by the COVID-19 virus and have an increased risk of severe COVID disease and death. At the same time, Philip Morris is donating face masks and other equipment in an attempt to cover up the millions of tobacco diseases and deaths instead of doing the one thing that really matters, which is stopping selling cigarettes. Continuing to sell cigarettes that can increase smokers' risks of severe disease and death from COVID-19, rather than using this pandemic as an opportunity to stop making them and thereby encourage smokers to stop smoking, just shows how much Philip Morris cares about its customers. In the Philippines, at least 107,000 people are killed by cigarette use each year. In Southeast Asia, there are 500,000 tobacco deaths annually, and apparently a few hundred or thousand more smokers dying from COVID-19 do not matter to Philip Morris. So we challenge Philip Morris here in Asia to stop the duplicity, stop marketing and selling cigarettes, accept liability, pay damages to tobacco victims, compensate governments for medical costs, and clearly specify a date to completely phase out all tobacco products. What I would like to point out is that you talked about successes in various countries, and in our own region we have had similar successes here and there. So there are countries where before there was no tobacco control legislation, now they do have legislation in place, but we don't have any single country that is fully compliant with the provisions of the WHO Framework Convention on Tobacco Control. Um, Cigarettes are still cheap in many countries. Um, our Philippine graphic health warnings are only half of the package, whereas in other countries they are much larger, 75, 80, 85%, and the largest is 90%. We still have smoking in many public places in many countries in Southeast Asia. Advertising is rampant in Indonesia, which is not a party to the treaty. So despite having these successes, I would say the tobacco companies are still several steps ahead of us. So we shouldn't be looking at just the successes, but looking at how these tobacco companies, particularly Philip Morris, has been blocking government attempts to strengthen their tobacco control measures. And I think that brings us back to this whole issue that we are trying to address tomorrow during Philip Morris's shareholder meeting. Um, we are being sold this story about Philip Morris being part of the solution, but let's all remember that they are actually stopping us from implementing the solutions contained in the FCTC.
Yul, that was my wrap up. So we're like done now. It's perfect. So thank you everyone for joining, our panelists, for the folks that joined on this call. Tomorrow, as mentioned, is the PMI shareholder meeting where many of us will be in the room trying to share our questions with the executives of PMI. Likely, we'll hear a different smattering of answers that may not actually answer the questions that we pose, but we're going to be there to speak truth to power, to talk about the real impacts of PMI's business operations all around the world, and to advocate for a world that is truly in alignment with the gold standard for public health and tobacco control, which is the WHO FCTC. So I want to thank all of these fervent advocates for tobacco control and public health, and I want to thank all of you, and signing off, and hope you all have a great rest of your day. Thanks so much. Bye.
Thank you. Bye.